All right. Good morning, everyone. Thank you so much for joining us. Can you all hear me okay? All right. Well, I know we have a very packed agenda, so I would like to go ahead and get started right at 11 o'clock. My name is Amanda Lofgren. I'm the Case Management and Quality Performance Division Director, and on behalf of the Office of Community Living Leadership Team, I'd like to thank you all for spending the next hour with us to talk about and receive updates on our key priority projects. I know our team has been working really hard with our community partners on preparing for all of the great work that will be implemented July 1st. And so today we will go over all of the projects and provide key highlights and key updates. We will be responding individually to questions as we receive them and as we are able to, but we will also use them to inform additional upcoming engagement and communication that we put out after today. There will also be opportunities to engage on these projects and work going forward. And so today our goal is really to provide high-level vision for how our projects and these efforts all fit together and impact our members and community partners. If we can go to the next slide, please. All right. So just as a reminder, we know that there have been a lot of changes and that things have been challenging, and there has been a lot of significant pressure on the long-term services and supports community and ecosystem across the state. We've had the overlap with the end of the public health emergency, the transition of our case management agencies as we have implemented the long-awaited case management redesign so that we can come into compliance with the 2014 federal requirements with the final settings rule and conflict-free case management. And then we implemented our new care and case management system, which has had impacts across our community. As we continue to work across the department to quickly resolve ongoing challenges that have stemmed from these, we know that there is also overlapping with our initiatives. And so we've heard from you and our community of partners, and we want to acknowledge that you all are tired and that there have been impacts to all of you. And so we want to create this space and time to adapt as we make the changes and hear and give regularly updates so that we keep you apprised on what is happening and how the department is incorporating feedback and implementing these changes. We also know that you have been waiting for many of these new initiatives, and there is a lot of excitement around the implementation of these projects as you have been working with us for many years to implement and have been championing these projects. We are trying to balance our commitments to the legislator and the long-term vision of evolving our ecosystem and our projects to be more person-centered, simultaneously knowing that we need to slow down so that we can address the stabilization of our rollouts of these larger efforts. With this in mind, we have narrowed our approach with the goals of easing the administrative demands on our partners, especially our case management agencies and our providers, while prioritizing these initiatives that are most critical, which are the projects you see on the screen here. So today our team will provide key updates on each of these projects and give updates on where we're at and the opportunities that are coming ahead. I also want to note that while we provide high-level timelines and deadlines, we will be finalizing these as we move forward, and we are currently working with our vendors as we implement them. So if we go to the next slide, I will turn it over to Lana Eggers to give us an update on where we're at with Community First Choices.
Great. Thank you so much, Amanda. Good morning, everyone. My name is Lana Eggers, and I manage our Waiver Innovation and Compliance section here at the department. So our team is responsible for two of the initiatives that I'll be discussing here today. First, I'll go over our Community First Choice initiative, and then as a project that's very, very closely related, I will go over our new Children with Complex Health Needs Waiver. So a quick overview of CFC. CFC expands access to home and community-based services. Members on both waivers and state plan will have access to more services and more service delivery options, which will help members stay in the community. CFC also has enhanced federal match, which will bring additional dollars to the state and help with the sustainability of our HCBS programs. Next slide, please. So really exciting news, Community First Choice is officially launching in about a week, I think 6 days from now on July 1st. This is monumental. The department and our stakeholders, we have been working together to implement Community First Choice in Colorado since this became available through the Affordable Care Act. So a little over 10 years we've been working on this initiative, and we are finally launching next week. Once we launch Community First Choice, that means that select home and community-based services will be available under the state plan. So members will have access to these services based on their need instead of the individual waiver that somebody's enrolled in. So if you think about our adult waivers, there are service differences between each of our adult waivers. Under Community First Choice, there will be this one service package that members will have access to if there's an assessed need. Our waivers are still standing. We'll still have a lot of services in our waivers, but some of those really heavily utilized services like personal care and homemaker, all of those are moving to the state plan, so we're expanding access to those services. We're also expanding access to our 2 participant-directed programs. So this is our consumer-directed attendant support services. This is our full fiscal agent consumer-directed model, and then also our in-home support services model, which is our agency-based consumer direction. So members will now have access to those programs, those service delivery options under CFC, and some members wouldn't have had access to those under the waivers that they are currently enrolled in. CFC also allows for legally responsible persons to provide personal care, homemaker, and health maintenance. Again, that was an allowability under some of our services and some of our waivers historically, but under CFC, we are making that available to all members who have an assessed need for the service. Next slide, please. So CFC, while we are launching next week, we are doing a tiered implementation for members. So our goal is to get members into Community First Choice as soon as possible, while also maintaining stabilization within our case management structure, within our provider structure. So members are enrolling into CFC at their yearly continued stay review. So if a member has their continued stay review coming up in July, that means that they would already have had that discussion with their case manager to enroll in CFC services. Somebody who has that process starting maybe in December, that's when they would be enrolled into CFC. For members who are newly enrolling into long-term care, so somebody who hasn't ever been on a waiver, or perhaps is transitioning out of a nursing facility and would like to explore home and community-based services, that type of situation would start on July 1st. So at that point, if a member is walking in and saying, hey, I would like to explore home and community-based services, I'd like to stay in my community, the case manager will be able to begin that process for enrollment into CFC on July 1st. Last time we talked, we were having some challenges with some of our system implementation, and I believe I walked you through some of the issues we were having. I'm here today to say very proudly that our systems are functioning as they should for the launch of Community First Choice. All of our system implementation has gone smoothly, and case managers and providers will all be able to have the tools that they need to either authorize or assess for services, and then also bill for services under Community First Choice. We also have regulatory approval for our Code of Regulations. So those are effective on July 1st. You'll see those posted publicly then. And we continue to develop educational resources. We hear from a lot of you on things that would be helpful to you. So we really appreciate that type of feedback. So if you have any additional educational resources that would be helpful, don't hesitate to let us know. We can try and incorporate them into existing items that we have, or consider creating new projects or new documents. But we do have a lot out there. So I would encourage everyone on this call to look at the Community First Choice website and peruse some of those resources. Next slide, please. Here are a list of the resources that I would recommend that you prioritize if you are confused about Community First Choice, just hearing about it today, or are looking at it for yourself or a loved one. There are a lot of documents here. Some of them are geared more towards members, some are more towards case managers or providers, but I do want to highlight that we just recently updated, as of yesterday evening, our comparison charts. So we have new comparison charts posted, and I believe one of my colleagues will put these links in the chat, and it'll help you kind of understand what's different between the waiver and CFC and which option might meet your needs or your loved one's needs the best. Small caveat that we are continuing to work through our website updates. So we have some outdated waiver charts. We have some links that we still need to update. We are kind of going through that process now. So just know that we have some updates that are continuing to be made on our website. So be patient with us as we get all those completed. But these are resources that are available to you now. Right, next slide, please. This might be the last time that I present this slide in one of these meetings, because as you see, we are at the end. I put a little star there just to show that we have made it to the end of our implementation timeline for CFC. So a ton of work has happened over the course of the last 4 years at the department to get this off the ground. But at this point in time, we have our waiver amendments are completed. We are beginning to authorize members into CFC, and our rate alignment necessary for CFC has been completed. So we have done a lot of work, and we are ready to launch next week. Okay, next slide, please. Next, I'm going to talk about our Children with Complex Health Needs waiver. So this is a program that is closely related to CFC, because with the implementation of CFC, we're moving some services out of our children's waivers that kind of held the waiver up. So what this waiver does is it will simplify access to children's waivers, it'll expand access to services, and also prevent children from losing eligibility under Community First Choice. Next slide, please. So the Children with Complex Health Needs waiver is a combination of both the Children with Life-Limiting Illness waiver and the Children's Home and Community-Based Service waiver. So we're taking the services in the CHCBS waiver, the Health Maintenance Activity Service, and that's going into the state plan. So children will still have access to those services. However, because it'll be under the state plan, we no longer need to maintain the CHCBS waiver. So instead, children who are currently on that waiver will be moving to this new merged waiver. It will expand access to services. And children who are currently on CLLI, it'll be kind of status quo. They will maintain their existing waiver services. There'll just be a name change for the waiver that they are currently on, with the addition of their new CFC services that they can also have access to. So similar to CFC, this will launch on July 1st, 2025. And members on the CLLI waiver will automatically move to the new CwCHN waiver next week. So if you're looking at the waiver that you're enrolled in, that name change will happen automatically next week. For members who are currently enrolled on CHCBS, that transition will mirror what's happening under Community First Choice, where a member will transition over to this new waiver at time of their continued stay review. So a case manager would have the opportunity to authorize CFC services and these new waiver services at that time. Next slide, please. So the service package under the CwCHN waiver is the same as it currently is under our Children with Life-Limiting Illness waiver. with the addition of our wellness education benefit, which is a monthly mailing that goes out with tips and tricks for how to remain in your community, stay healthy, things like that. Personal care, health maintenance, and homemaker, that is still a service expansion, and that will just be available under CFC. So for the most part, we're going to see a lot of members who are enrolled in both waivers and CFC at the same time. It will be the exception to have a member just on CFC or a member just on a waiver, because we do find that members typically have the desire and the need to access services of both across these federal authorities. Next slide, please. Similar to CFC, we are rocking and rolling. All of our system updates have been completed, and our regulation was approved by the Medical Services Board. So we are ready to launch this new waiver next week. I added a couple of resources here that are specific to this initiative. The resources that I showed under the CFC program, there's some overlap there. So you might learn something about the waiver merger in those resources as well, but these are specific to the Children with Complex Health Needs waiver. Next slide, please. So again, we are at the end of our timeline, so exciting stuff here. We are looking forward to having members enrolled in this new waiver next week. And we're looking forward to the year of transition for CHCBS members. And we are seeing that things are moving slowly, that things are moving well so far at our case management agencies. And we are just really looking forward to the progression of this new program. I am staying on the webinar, so if you guys have any questions, feel free to put them in the chat and we will make sure to get those answers to you.
Thanks, Lana. We'll bring you back in a little bit to answer some questions. Next up, we will have Haley give us an update about the supports intensity scale decommission and our interim support level assessment.
Thanks so much, Amanda, and thank you, Lana. Hi, everyone. I'm Haley Gleason. I am the Strategic Outcomes Division Director within the Office of Community Living, and I'm excited to give an update on the support intensity scale decommissioning and being replaced with the interim support level assessment. Next slide, I'll go over a couple of updates on where we are with this project. So a little bit of background, the support intensity scale has to be decommissioned by the end of June. So next week, we are retiring the CIS, as we call it. And in order to do so, we need to replace it with a new tool, which we have been working to develop and pilot test. And that is what's called the Interim Support Level Assessment, or the ISLA. And that will replace the CIS as of July 1st. So we are transitioning from one assessment tool to a new tool. It's really important to understand who this new tool will be used for. We are only using the ISLA for newly enrolling DD and SLS members that have never been assessed through the CIS before. So they do not currently have a support level determined. And so they need to go have this assessment tool. So that will be used, the ISLA will be used for those newly enrolling members who are requesting DayHab, supported employment, or ResHab, so those services. So it's a very narrow group of members that will be actually utilizing this new assessment tool. For those current members who are already receiving these services, they will continue to utilize their existing CIS support level. So they do not have to go through a new assessment. They will just have that CIS support level and will continue on, so they won't see any impact with this change. If they have a change in condition, or if there's some change that they would like to have relooked at related to their support level, totally fine, and we have a process for that. So that is the support level review exceptions process. So that is in existence today. That will continue on. And so if a member would like their support level to be re-examined or reanalyzed, looked at, they will go through that support level review exceptions process, and would again not have to have a new assessment performed using the ISLA. Next slide, please. So where are we in rolling out the new ISLA, this new assessment tool? We conducted the ISLA Assessor training in March. We were really excited to have 92 assessors that were certified to conduct the ISLA. There was, as I said, a training that was required and then a competency exam that was required after that for them to be considered certified to administer the ISLA tool. So that has been done. We have received approval for our waiver amendment and our rules. So that is all in place for the July 1st implementation. And we have been conducting a pilot. So this is, like I said, a new tool. We wanted to have our new assessors out there conducting the tool with members so that we could, one, give them a chance to get to know the new assessment and the process and the tool, all of that. Allow members to experience that. So we have a member experience survey that's been conducted for those who have been participating in our pilot so that we can understand what their experience is with this new tool, and then also to gather some data. So all of these members that have been participating in the pilot have also had the SIS assessment. And so we are able to look side by side at the outcomes of the SIS assessment and the outcomes of the ISLA assessment and really make sure that we are seeing what we would expect. And so that we know that this tool will be comparable and even better than the SIS tool. So, so far we have been really excited about our pilot participation. We've had nearly 100 pilots completed. Like I said, we've also had that satisfaction or survey that's been completed and are using that to develop and validate the ISLA algorithm. So that has been ongoing throughout the pilot period. We have another meeting with our stakeholders to talk through our findings this week and are really feeling confident about what we're seeing from that pilot. And so are really excited for our July launch. Just wanted to add as well that first quarter of the full ISLA launch, we'll also be using the results from those assessments to further refine and improve and validate our new ISLA algorithm. So this doesn't end when the pilot ends. That work will continue as we continue to gather new assessments through the first quarter. And again, we'll be continuing to work and report out to stakeholders on what we hear and the findings from that. Next slide, please. And this is just an overview of our timeline. We are almost at the star here for July to launch the interim support level assessment, but you can see all of the work that has been done to date, submitting our waiver amendments, our rules, working through the pilot and working with our stakeholders throughout to make sure that we are in alignment with the new tool and with our findings from the pilot and the new algorithm. So really a lot of work from our stakeholder community who have been fantastic partners. So thank you to them. And we're excited to move this forward for the July launch. Also just wanted to mention that there were some system changes that were required for this project. We had a successful production and go live for that last week. And we have one more that's going on early next week, and we are seeing no issues. So really in a good spot for this project to get things launched next week. So thank you so much, and I will turn it back over to Amanda, who will pass us on to the next project.
Awesome. Thank you so much for that update, Haley. And I would just like to echo, because I see some names that are on the webinar here that are also part of that stakeholder group. And we couldn't do this engagement and the development of this work without all of the extraordinary input and hours of engagement that you all have contributed over the years. It has taken a lot of effort to get to where we're at in the navigation of the multiple phases and stages of moving towards the decommissioning of the SIS and the development of the Colorado Single Assessment Tool. So thank you. All right, next up, we have Cassie Keller to talk about the Pediatric Long-Term Home Health Prior Authorization Request Restart, as well as the Nurse Assessor. So Cassie, I'll just tee you up for both of them.
Thanks, Amanda. As she said, my name is Cassandra Keller. I'm our Community Options Benefits Section Manager. My teams oversee all of our home and community-based services, as well as several of our state plan benefits of long-term home health, private duty nursing, and pediatric personal care. We are in the process of re-implementing our pediatric long-term home health prior authorization requests. Those were paused during the pandemic. Then we had our maintenance of effort with our American Rescue Plan Act. We finally have received notification from our federal partners that MOE, that maintenance of effort, is lifted and we can resume those PAR requirements. As a reminder, for pediatric long-term home health, we're looking at all of these services of occupational therapy, physical therapy, speech therapy. Those are for our pediatric members, and then registered nurse and certified nursing assistant services. So all of those will have the resumption of PAR requirements beginning July and then August. I'll talk a little bit about that timeline. Just reminding you that the reason we're reinstituting these long-term home health PARs is because it's crucial for ensuring resource optimization, improving care quality, maintaining compliance with state and federal Medicaid regulations. We have to have this type of medical necessity review and prior authorizations for these services. Next slide, please. So what we have done is we have done what we have called a soft launch for our PT, OT, and ST therapies. They started in February of this year, and we have had resounding success with that process. We have had nearly 10,000 PARs submitted since that time for almost 10,000 unique members with an 85% approval rate. So it has really showed that providers have done a phenomenal job of assessing members and having those services proven to be medically necessary at the requested amounts. And so really appreciative of all of those providers who have done such a great job with those submissions. So we will be going live where PARs will be required beginning for those services or those therapies on July 1st. Providers have been notified about that. We've issued an operational memo notifying of that start date. And so that begins in next Tuesday. For the rest of those services, for registered nurse and CNA PARs, that work is going to begin actually, and those PARs will be required on August 1st of this year. Next slide, please. So this ties very closely in with our nurse assessor process. And so you can see we've been really working on getting that contract set up for the nurse assessor and having all of that work coincide and line up with the nurse assessor program and then that PAR restart. So we are getting really close. We'll be launching those PARs for therapies in just a couple of days. And then in 1 month's time after that, we will be doing the PARs for RN and CNA services. Next slide, please. So for the nurse assessor program, just a refresher and reminder of why we're doing this and what this is going to do. So this initiative was approved a couple years ago through a budget request. It's really this process to streamline the way members are assessed and receive the recommendation for skilled care services. The nurse assessor will utilize our newly developed and valid and reliable acuity tool. It should help reduce duplication of service authorizations and remove that conflict of interest on behalf of providers while providing members education on all available skilled care service options. Next slide, please. Just to get into it a little bit further of why we're implementing this process. The current process really includes different variable assessments for skilled care services. Home health agencies each have different approaches to these assessments. And with the nurse assessor, we're going to have a standard and equitable assessment process for all ages and populations seeking skilled care services. So we will not be seeing this vary whether you're a child or an adult, or what type of service you're looking to have. Under the current process, members may be receiving duplicative services due to the bifurcation in agency oversight and assessments. Under the nurse assessor, one assessment and one recommendation for skilled care services will be provided based on assessment and then member choice. Education and information will be given to members about all the available service delivery options available. Not just based on maybe this home health agency that they've worked with only does home health, and maybe they don't do private duty nursing, or they're not going to advocate or provide information about self-directed options. So we really are making sure that members will be given information on all the different ways that they can receive their skilled care, not just one modality. Right now, there's an inherent conflict of interest where the provider agency assesses a member for the services that they provide. The nurse assessor is going to eliminate that conflict. And a member may receive multiple assessments by different home health agencies based on their needs and what services that home health agency provides. So under the nurse assessor, there's going to be that one singular assessment, one singular recommendation for services, and streamlining that process, and hopefully makes it a lot more expeditious for the member. Finally, the nurse assessor is going to support the resumption of medical necessity review and the PARS for long-term home health. While reviews were paused, home health agencies made decisions without medical necessity reviews. This could have meant that some people got more care or a higher level of care than what was medically necessary. The nurse assessor will ensure members are connected to the appropriate services and connect members to new services offered through CFC. Next slide, please. So as you may have seen in that colorful timeline, we have had a bit of a timeline change. Despite our extraordinary efforts and on behalf of TeleGen and HCPF, the teams have encountered delays in ensuring that key components of the system and program are ready. So what we are doing is having a slight delay of 1 month. So instead of a July 1st implementation date, we are looking for an August 1st implementation date. So that means the nurse assessor program won't start until that date, and then the PAR resumption for RN and CNA will not start till that point either. We want to make sure that that assessment program and the PARs coincide and start at the same time. HMA reviews will continue under their existing approval process until the nurse assessor is implemented. I did see a question in the Q&A that asked if IHSS in-home support services if they were allowed to be continued to be authorized during this period of time. The answer is absolutely yes. Case management agencies can continue to authorize IHSS health maintenance activities during this time. They just would not use the nurse assessor program. They will be using the existing program through TeleGen, which can be a little confusing, TeleGen in both roles, but they will use that existing process to receive approval on the health maintenance activities care up until that time. We've also extended our contract with TeleGen in their current URUM capacity to make sure that they can conduct those reviews all the way up until the nurse assessor program begins. Next slide, please. So we have been meeting with all of you wonderful folks and stakeholders for the past several months to talk about this program, answer your excellent questions, and hash out some of the details of the nurse assessor program. We have gone over the acuity assessment. We have talked about some of the very specific components of health maintenance activities and how we can ensure the assessment is appropriate and working for members who receive health maintenance activities through the self-directed options. We have garnered your feedback on the criteria developed for when an assessment should be done in person versus virtual, as well as what should that criteria look like when we need an expedited review to take place. Your feedback was valuable, and we have incorporated all of that into the final versions and should be sharing that with you at our next meeting. And you have asked just fantastic questions. We have hundreds and hundreds of questions on our listening log, which is updated each month. And it's been since updated for our June 10th meeting, where we're really trying to make sure everyone has an understanding of what is the role for a home health agency, what is the role for a case management agency, and how all of that works with and interacts with that nurse assessor program. Next slide, please. One final slide here of kind of where we're at and what we're looking for. In this month, we are working on training for stakeholders on the nurse assessor process. We did have a little bit of a delay in some of those trainings, but we've had trainings already taken place. All case management agencies and home health agencies and any entity that will be submitting a referral has to receive credentials in how they can utilize the Telligent platform. And so we've had that training take place for how to be that, it's called an authorized official. So that training is taking place. We've got several trainings coming up hosted by Telligent for providers, case management agencies, and then interested stakeholders on how they can use the system and send referrals. We also have a HICPUF planned training for our case management agencies. I know you all have been clamoring for some specific details on exactly how case managers will function within the CCM and what their role is and what things look like. So that is going to be taking place later this month. And then in August, we will be conducting those assessments and then really evaluating the data as it's rolling in, and really trying to garner your feedback. We've got a feedback form that we'll be using and really trying to hear from you all. How is it going? Did you have an assessment with the nurse assessor? How did it go? What was positive? What was negative about the experience? And really trying to fine tune the process from there. So we have our next meeting scheduled for July. I want to say July 8th, but I'm not entirely certain on that. But we look forward to speaking with all of you again and going over some of these details and sharing the recommendation letter that will be the output from the nurse assessor in that July meeting. So thank you.
Awesome. Thank you, Cassie. I appreciate that. Next up, we're going to have Christine give us an update on transition and diversion efforts.
Hello, everyone. I am Christine Dos Santos with the Compliance and Innovation Division, and I appreciate the opportunity to speak about our ongoing efforts to support individuals transitioning from institutional care back into their communities, as well as our diversion efforts. Our transition and diversion projects are designed to ensure that members have the information and options they need to make informed decisions about where they live and how they receive their care. They're also essential for meeting our obligations under the Department of Justice settlement, which was signed October 31st, 2024. Next slide, please. First, I'd like to share some updates about our Money Follows the Person, or MFP, grant. MFP is a federally funded initiative that helps Medicaid members move from institutional settings like nursing facilities back into their homes and community-based settings with the right supports in place. Some updates we have about our progress with the MFP grant is that since July 1st, 2024, we've provided rental assistance and arrears support to 174 eligible members through our MFP Housing Assistance Supplemental Service, which has helped removing one of the most significant barriers to successful community reintegration. Additionally, we have also launched the MFP Environmental Adaptations Supplemental Service, which is now going to be available to members transitioning from nursing facilities. This service covers key home modifications, such as wheelchair ramps or grab bars, to ensure returning members have safe and accessible living spaces upon their discharge from nursing facilities. Looking ahead for the MFP program, we have some additional supplemental services targeted to launch in fall of this year. Those include our pre-transition peer mentorship, which offers support from individuals with lived experience, our food assistance service, which addresses immediate nutritional needs during a transition, and finally, pre-tenancy support, which helps members build readiness for successful sustained housing upon discharge. Next, I want to highlight an addition under our 1115 waiver, which is focused on health-related social needs, or HRSN. Through this amendment, we will provide tenancy support services to eligible Community Access Team Voucher, or CATV, recipients. And these services are designed not to just help members secure housing, but to maintain it post-transition, which is essential for long-term health and housing stability. Next slide, please. And as you'll see here, this is just a timeline. You'll see that these updates are part of a larger coordinated effort under our nursing facility transition and diversion priority projects. Money Follows the Person implementation will continue through fall of 2025. Upcoming, we have individual inReach, which is targeted to begin next month in July. And looking ahead, rapid reintegration and referral and presumptive eligibility for long-term supports and services are both planned to launch in January of 2026. Thank you again, and I look forward to any questions you may have.
Thanks, Christine. I appreciate it. All right, next up, I will give a short and sweet update on where we are at with the care and case management system. And for those that are newly joining us or may not have heard about the care and case management system, this project is a priority project for us because it is a new information technology system that we have implemented for our case managers. It is a one system that our case management agencies are using that supports all required case management activities. And the goal and purpose around it is to ultimately reduce administrative inefficiencies by having duplicate data entry. Historically, our case managers have used 3 IT systems. And so this platform allows for automation of workflows, interfaces between our MMIS system and our billing systems for providers, but also our financial eligibility system. It allows for modernization of multiple decade-old legacy systems, and it is a platform that will allow us to be more adaptive and responsive to major programmatic initiatives to support the changes that we have been talking about today and giving updates such as CFC and other key priority initiatives for the department. As well as the interfaces that I mentioned to streamline the information sharing between priority projects. So if we go to the next slide, we have had a number of challenges with the implementation. And so the department has a dashboard that we have on our public website that shows where we're at with the stabilization and the key enhancements for the IT system. And you will see here where we have the percentages of completion and the total features and where we're at with being on track, the completion, or on or whether that is delayed. And so we have prioritized the implementation of the system readiness for community first choices and some of our other projects. And so you will see the completion there, as well as making sure that our case management agencies have the reporting that they need so that they can do their billing activities and some of the other required activities that they need to do their day-to-day work. And then there are some delays with the finalization of the stabilization items needed for the streamlined interfaces and some of the data quality work. And those activities will continue to resume as releases are on a biweekly schedule. So that is where we are at with the CCM system enhancement and the dashboard. If we go to the next slide, similar to all of the key priority projects, you will see here that we have when the CCM implemented was July of 2023 for phase 1, and those were the key standardized functions and features for case management agencies that was historically known as our bus system. And then February of 2024 was when we implemented what is now called streamlined eligibility and the interface with our financial eligibility system. And then we have been working on the stabilization and the implementation and readiness for our key initiatives for July 1st. So with that, we will go to the roadmap to the priority project implementation and talk through where we're at on slide 33. And Haley, I think this is where we will segue into the timelines for how all of these key initiatives fit together, and then talk through the communication and the landing page, and then we'll bring back all of our policy staff to talk through and answer live some of the questions.
Thanks, Amanda. Yeah, I'm happy to jump in and give an overview of how all of this fits together. If you want to go to the next slide, please. So I know that was a lot of information across all of these really important projects. So we wanted to bring it back to this higher level timeline that sort of gives you a snapshot of where we've been and where we're headed. So as you can see, this goes back to December of 2024. But as many of you know, the work around these projects, goes well past that. These have been, we've been working with stakeholders. These have been in the works for a long, long time. And, over the last particularly 6 months, we have been working hard to make sure our systems are ready to implement. We have the rules and waiver or state plan amendments in place. We have contracts in place. We've conducted pilots. As you've heard across all of these projects, lots of work has been done. And now here we are. We are, less than a week away from our July 1st launch of many of these projects. And so you can see, the list here of the projects that are all going live next week. Again, lots of work. Systems changes are in place and ready to go. Training is in place and has been done, and our case managers are ready to go. So lots of work has already happened. But July 1st really launches the initiative. So we're so excited to be at that point where we can say that we are, on the cusp of getting these new programs out and live for our members. But the work doesn't end on July 1st, as all of you know. From July onward, we will be monitoring very, very closely the launch of this work to be able to report out and make sure that everything is going as anticipated. And if there are any unintended problems, consequences, concerns, anything that comes up, that we are very ready to jump on those and get things addressed quickly. So as you can see, we have July 1st to June 2026. We will just continue to monitor very closely. Everyone on this team that you've seen has plans in place for making sure that we get to stabilization, which, is a whole different phase than the implementation phase. So that's what we're moving towards now and really getting prepared for, is post-implementation and ensuring that everything is working as we would expect it to work. Next slide, please. With that in mind, we wanted to make sure that everyone was aware of our communication strategies and how you can get in touch with us should you see something that you don't think is working as it should, or if you have a question about what one of these new programs. So what, something is unclear to you, you are unsure about the process. If you need to get in touch with the department in any way, we want to make sure that you can get to the right people. So we have a new priority project landing page. We will put the link in the chat so that you can familiarize yourself with that page. We've redesigned it to make sure that it's very easy for you to navigate, and so that you know who to go to, where to go with your questions or concerns. Next slide, please. We have a number of different avenues for you to be able to outreach to the department to get your questions answered quickly. We obviously have our new landing page that will provide this information to you as well. So you don't have to memorize this in this moment, but just wanted to walk you through it so that you are aware as we move towards July 1st. So as always, we have our general question inbox. So if you are unsure of where to go, send your question there and we will behind the scenes get it to the right person. So that's a great spot to, have that email saved in your inbox, because that's a great spot to just go to if you're just you don't want to navigate, just send it there. We also have here our county contact, our case management contact. Obviously, we want to direct our members in particular to the appropriate county and case management agency so that if it's a particular question related to their services, they can get to the right person. We also continue to have our member complaint and escalation form that is live and is a great spot if there is something that the member has escalated to their case management agency or their county and they are not getting an adequate or timely response. That is the place to go. So send those concerns or questions straight to the escalations form, and we will push that through and get it to the right person. And then in addition, we have our priority project emails here. So each of our project teams have an email inbox that goes directly to the team so that they can respond to your question if it pertains to that particular project. But again, if you're not sure, or if you feel like it overlaps with multiple projects, don't worry about that. Just send it to the main inbox and we will get the response for you. So I don't want you to feel like you have to have every single one of these email addresses memorized. Not necessary, but if you do know, like, hey, I know it's an ISLA question, we've got those inboxes ready for you so that it can get right to that team. And then at the bottom here, you can see we always have our call centers. So if you want to talk to someone, that is always an option too. We have a member call center, provider call center, and our CCM call center. So those are available as well if you want to pick up the phone and have a conversation. So lots of avenues to go through to get your questions in, or if you're seeing something that doesn't look quite right, get those over to us so that we can be sure and jump on it. And as I said, we've got a plan in place to respond to those quickly and make sure that we are identifying any issues that are emerging post July 1st. Next slide, please.
All right.
All right,
Thank you
Amanda,
so
I
much,
think we're
Haley.
ready to.
I appreciate that. And I also appreciate laying out the support that we have put in place to wrap around the community and the partners, because we do anticipate that this is a lot of information. This is a lot of changes. I know our case managers are learning all of this and navigating as quickly as they can. And there are anticipated to be some bumps along the way. And so we appreciate all of the collective and the community support, and the department is ready to lean in and help. So we have some questions we flagged. Lana, Cassie, if you guys can come back up, I'd like to maybe put you on the spot here with some questions. So the first one, Lana, is can home health companies calculate hours for CFC, CNA, CES, or IHSS, or is this solely the responsibility of case managers?
Sure. Thank you, Amanda, and thanks to whoever asked that question in the chat. This question refers to our new direct care service calculator, which is a combination of tools that have been previously used under our CDOS and our HSS programs. This is a tool that will now be used for services under CFC, so for personal care, homemaker, and health maintenance. And it is the role of the case manager to complete the direct care service calculator. A provider agency should not and cannot be providing this or completing this and then providing a completed document to a case manager. We have heard instances of this happening. So I want to be clear that this is the case manager's role to fill that out. And once it's completed, a copy of that will be provided to the agency. We did release a memo, which I believe we have in the chat here, that goes through the roles and responsibilities for this document.
Great. Thank you so much, Lana. The next question is it true that clients can get more hours for CFC, CES if case managers choose to allow for it?
Sure, that's a good question. So CFC services will be assessed for and authorized in the same way that waiver services currently are. So a member would go through the 100.2 level of care assessment and be authorized services that meet their needs. Under the new process where we have community first choice and a waiver, the member would be assessed for services that are available on the waiver in which they're enrolled and under community first choice. So short answer is no, you wouldn't receive more services just because the service is moving to CFC. However, there may be additional services that you have access to now that we are implementing CFC.
Great, thank you. I also realized I used acronyms and I need to put some dollars in the acronym jar. So my apologies, everybody, for not spelling those out. All right, Cassie, you're up. Have all of the training documents and enrollment paperwork for consumer-directed services with Colorado, geez, now I'm on the spot with the acronyms, CDCO, which I know you're going to spell out for us, and all of the financial management service vendors been updated?
Sure. Yes, our vendors, Consumer Direct Colorado, CDCO, our training vendor, and our FMS vendors, PPL and Palco, have updated their materials. There's some reflecting of the nurse assessor program in there, and then any regulatory changes that we've made. Those updates have been made by the vendors.
Fantastic. And thank you for helping me with the acronyms on the spot. All right, Haley, the next one for you is who will conduct the interim support level assessments?
Yeah, thanks, Amanda. So actually, most of the interim support level assessment assessors were previously CIS assessors. So they are either employed by the case management agency or are contracted by the case management agency to perform those assessments. And like I said, many of them were previously CIS assessors who then came and participated in our required training and took the competency exam. So that is also a requirement that they pass the exam to then be on our list of approved assessors. And so those assessors will be contracted or again employed by a case management agency. And we feel really confident in the number of assessors that we have currently to perform the ISLA. We were really excited about how many people we had sign up for our training and complete the competency exam. So that's who's going to be responsible for completing those assessments.
Awesome. Thank you so much, Haley. I really appreciate it. And I appreciate team coming on and giving some of those live questions. And thank you everyone for joining us this afternoon and sharing your questions in the chat. I know the teams were responding to those directly, and the ones that we were not able to get to, we will use that and all of the questions to feed and inform future presentations and the work and the communications that we put forward forward going after today, so that we can really make sure that we're getting the information that you all need and you're seeking, so that you're staying updated on the great work of these projects. So with 1 minute left, I really appreciate everybody, and have a wonderful afternoon. And I cannot believe July 1st is 5 days away. So we appreciate all of the extraordinary work and collaboration and partnership over what feels like several years in the making to get us here. I know CFC has been a topic of conversation for a very long time, as well as all of these other projects that we've been working on. So thank you, everyone, and we'll talk to you soon. Have a great day.